Good afternoon and welcome to the third webinar in our healthcare series. Are you ready for HITRUST? I'm joined today by Adam Birnbaum, the Chief Compliance Officer at Altruista Health, and I'm Carol Amick. I'm the Manager of Healthcare Services at CompliancePoint, where I work with healthcare providers and business associates of healthcare providers to identify, mitigate, and manage privacy and data security risk. I'm also a certified HITRUST assessor and help companies meet their HITRUST requirements.
Hi, my name is Adam Birnbaum. I am the Chief Compliance Officer and Associate Vice President of Security and Risk Controls at Altruista Health. Altruista Health is a population health management solution company. We basically help the healthcare community, especially providers, to provide managed care services through population health to their consumers, approximately 50 million throughout the United States. At Altruista, I have accountability for not just achieving and now maintaining HITRUST certification, but all regulations, corporate compliance, risk management, data security safeguards, auditing, governance, and hopefully some of the things you'll want to hear today.
The objective for today's webinar is to understand why you might want to consider doing HITRUST, to help you gain an understanding of the HITRUST control framework and the HITRUST assessment process, and then to talk about some remediation opportunities that clients often find helpful to address before they start fully engaging in the HITRUST process. During the webinar, feel free to enter any questions you might have into chat, and we'll also be answering questions at the end of the webinar, but we'll try to answer them as we go along too. So why should you do HITRUST, and what is HITRUST even? HITRUST was originally developed for the healthcare industry. It stood for Health Information Trust, as a matter of fact, and it was developed by experts from providers, business associates, payers, and others to come up with a framework to help identify and address cybersecurity risk. So it's a standard that gives us some measure of assurance that we are doing the right things to address our risk. So you should adopt HITRUST because that is a real concern right now. There is an increasing risk of cyber threats. For those of you who are business associates, there's an increasing reliance on the business associates and a lot of pressure on you to make sure you're protecting the data that your partners are giving you. The increasing interconnection between the healthcare industry is adding to the cybersecurity risk. And you're seeing this continue to be a requirement within the industry, particularly, for example, by the payers who want their vendors to be doing HITRUST. And of course, overall in the industry, it will increase your trust and transparency. So why should you get HITRUST certified? The main driver for a lot of our clients who are getting HITRUST certification is to meet a contractual requirement of their business partner or client. They have been requested to get a HITRUST certification to prove to their business partner or client that they are protecting protected health information. But there are other reasons, including the desire to mitigate risk around your information security posture, to reduce the time required to respond to questionnaires from customers and business partners. Instead of filling out long, laborious questionnaires, you can just give them your HITRUST report. And then, of course, if you do HITRUST over time, you can track and demonstrate progress in addressing your security concerns. The HITRUST CSF, according to HITRUST, has been adopted by 81% of hospitals and 80% of the health plans as either a best practice resource or as the basis for their information program. So you can see that it's a very common standard within the industry. So Adam, why don't you talk about what you all decided to do?
Thank you, Carol. And I do want to point out something that she mentioned a moment ago regarding why do a lot of organizations go for HITRUST? And she was absolutely correct for us as well. So a few years ago, we started to see it appear in RFPs, risk assessments, and expectations from several of our customers, existing and ones we were bidding for. And prior to that, the organization didn't even know what the HITRUST word meant. And so they brought me on and my predecessors to look at what exactly does this entail? Why do we have to do this? What's important about it? And how do we go by doing it in the most efficient, effective, and for their sense, resource-friendly way possible? And it wound up being due to partnerships. Often privacy and security regulations are seen as inhibitors rather than contributors. When organizations view the regulations as guidelines for how to get work done safely, it actually can be a relief. Accountability for timing and selections becomes shared, not just by IT or compliance or risk, but by the entire organization. Now, wouldn't that be a relief? It really is easier for everyone to come together and not view the regulations or certifications or frameworks or standards as something you have to do because of an RFP, state regulation, or federal regulation, but something you want to do because it makes sense. And HITRUST is a great way to get you there. Instead of focusing on meeting those HIPAA regulations or state security regulations, HITRUST helps you look at the organization and gets you to a place where you're making risk-based security and privacy decisions because it makes smart business sense. And that ultimately is easier for the entire organization and you in specific. When we were working towards HITRUST over the past year plus, my mantra was, and to be fair, we were also building some of the controls and processes, either re-engineering or just building what was already there in a process improvement perspective. If we mature our controls and processes because it's good for us and our customers, HITRUST and our ability to achieve the regulations will happen organically. It was a way to make it so that we were helping ourselves versus using something like HITRUST or HIPAA or high-tech as a negative. And it wound up being easier for the organization. It became something we wanted to do. That's one of the great things about HITRUST and why I'm glad we dedicated the time working on it. It brought the organization together in ways that I'd only dreamed of or wished I had even in other organizations, because we were able to build our practices without viewing it as something negative. HITRUST really is the gold standard, because it's not just someone in Texas saying, you know what I think they should do. Instead, it's industry experts collaborating and saying, this makes sense for them to do. Now, I've been working in compliance, especially with HIPAA regulations, for 20 years now. Some of you are probably in the same ballgame. And I remember when the cartoon on your screen was actually a reality. When health organizations were staring at the regulations and wondering whether or not the commandments would be easier to implement. Now, when you mix in risk management, security, the governance frameworks, it can become really daunting. Imagine all the alphabet soup that's out there. I like to joke that I can account a patch of my gray hair to those regulations and frameworks. Unfortunately, my children caused the rest. Now, HITRUST won't keep your hair from turning gray, but it does have a formula that lightens some of the pressures and resource commitments necessary to strengthen your organization. So you know what? Maybe it does help a little bit. But all joking aside, due to past working experiences, I have seen HITRUST evolve over many years. It wasn't always the gold standard or a requirement that you're finding in those RFPs we discussed earlier. Like everyone's information security program, it had its infancy that evolved over time. What hasn't changed has been its industry's partnership focus on helping to ensure organizations have done the right thing. Now, for some of you, it might feel like a lot of work. However, through teamwork, you can get it to be fun, you can get it to become easy, and that will drive positive data security change. And that's what we're all about. When we were done in our organization, some people even admitted that while it felt difficult and daunting at first, once they started writing that first policy or figured out what that first piece of evidence looked like, became really easy. And that's where the change and the improvements and the evidence started pouring in, and what looked like a daunting task really wasn't. So, look at it for your organization and think about how best to do it and get the people who can help you. And then for those who you think might be detractors, build those relationships, build those partnerships, because ultimately, hopefully, you'll feel that same experience.
And if you do, at the end, you get your HITRUST certification. And this is the press release announcing the Guiding Care platform has achieved the HITRUST certification. I will say that we were the firm that helped Adam with that certification, and we really enjoyed working with them. And I think he points out some of the benefits to your overall organization in terms of maturity and team building, of getting together and making yourself meet that gold standard. So now that we've talked about why you should do it, we need to talk about what is the HITRUST CSF. And the HITRUST CSF is a common security framework. It's a defined set of requirements that was originally designed and built specifically for the healthcare industry. Now, some of you may have seen recently that HITRUST has made a decision to kind of become a little more agnostic and go towards putting the same framework into other industries. And I think that's because, as Adam talked about, this is the gold standard, and they feel like other industries that may not have protected health information but have other protected privacy information could benefit from having a certifiable framework to prove that they are taking care of your data.
Carol, if I may, it's actually a wonderful addition that they're considering doing, because we've seen banking be ahead of the game for privacy and security than healthcare by almost 10 or 20 years in some circumstances. Imagine some of the organizations and industries behind us. Look at social media and organizations like Facebook, Instagram, Google. Now think about if everyone had an application to that gold standard. You actually might start seeing better global privacy and security safeguards.
I think you're right. HITRUST has gone in the point of they've tried to unify a lot of security standards, and I have not listed all of the security standards they've implemented into their framework here, but this is some of the major ones: the ISO 27001, the PCI, Joint Commission if you are a covered entity, HIPAA and HITECH for people who are involved in the healthcare industry, the CMS security regulations if those apply to you. And then, of course, the state privacy laws, depending on where you are. You may have Nevada has privacy laws, California has privacy laws, Massachusetts. As the laws are implemented, HITRUST does continue to update their framework to reflect the privacy laws of the states that you may need to include in your assessment. So the HITRUST control framework has 149 control specifications that they have grouped into 19 assessment domains. And you can see the assessment domains listed here. They range from your basic access control and password management, which you might have expected, to physical and environmental security, things like, do you have fire extinguishers? Adam had to take pictures of his fire extinguishers for me for part of his controls. So you're looking at a lot of different things. They're broken into these 19 domains. And by the way, one of the unique things about HITRUST that some of you may not have experienced with other control frameworks is that to get a HITRUST certification, you have to pass all 19 domains. It's not kind of a majority. You have to pass all of them, and they have differing numbers of controls within them. So, for example, I'm currently working with a company that has 3 controls in wireless security. If you don't have one of those controls in place, it's going to be very hard to pass that wireless security domain. But then in access, they've got 50 controls. So they may have one control that's not in place and still be okay. So you can kind of see that to get to passing, you've got to meet all these standards, and there's a lot of areas.
And with that, this is where the risk-based approach comes into play. So while, Carol's example, one organization had 3 and 50, you might wind up having 6 and 25. That's where HITRUST becomes unique, because your organization and your risks determine whether you have few or many standards you have to meet.
Yeah, and we'll be discussing as we go along the risks that you will be looking into. So once you pick your framework, once they've done the framework, there's an implementation level for every one of those 149 controls. And that's, as Adam talked about, defined by the organization and the system risk. For each of the control specifications, there are up to 3 levels of controls requirements. And they build on each other. So it's not like if you get to level 3, you don't have to meet level 1 and level 2. You've got to do all the controls leading up to that. Basically what this means is every organization has a different number of controls and different set of controls that are based on their risk, as Adam said, for that organization when they do the control framework. So let's talk some about those risk factors. These are the main risk factors. When you get a HITRUST assessment, when your HITRUST assessor is working with you, you will scope your assessment. And these are the main risk factors that show up in there. Organizational, which is the volume of the business. Generally, that would be considered an individual record. For example, a patient record, a medical record. That's an individual record. And the geographic scope. Are you state? Everything in one state? That's lower risk. Are you multi-state? Then you have to look at things like if you're doing business in California, do you need to include the California Protection Privacy Act requirements? Are you international? That brings another level of risk into it. Then there's the regulatory risk that apply to your organization. There's the PCI for debt credit card security. There's FISMA for federal security. There's the high-tech breach notification that just about anybody in the healthcare industry has to comply with. There's the Joint Commission accreditation if you're a covered entity, and so forth. And then there's an evaluation of your system that you are assessing. Does it store, protect, or transmit protected information? Pretty much everybody's going to answer yes, so they would not be going for a HITRUST certification. Is it accessible from the internet? That's a risk factor. If not, your risk's lower. Is it accessible by a third party? And that's somebody other than your customer. So that would be if you have another party involved in your transactions. Use of mobile devices. And by mobile devices, they do mean laptops, not just cell phones. So that's another one where a lot of people hit that risk factor. Is it a health information exchange? Are there interfaces to other systems? The number of users and the number of daily transactions. Overall, the biggest driver is your volume of business. And just to give you a clue, the HITRUST's low end is 10 million records. So if you're under 10 million records, that's low. If you're over 60 million, that's high. If you're in between, you're in the middle. And that's one of the biggest drivers of your risks. Adam, what did you think about it?
Well, and this is actually where I want to give you advice based on our opportunities to learn, and a great opportunity. It is a great opportunity to work with your assessor, because when we first did the self-assessment and the validation risk assessment scoping, we had done it based on projections of where we believed we were going to be at a certain time, not based on the current state. As a result, we unfortunately misscoped our HITRUST assessments that later, fortunately to us, or fortunately for us, we were able to adjust, and it reduced the amount of controls. But it also works the other way. If you take a little longer and your risks have increased, you might wind up being surprised just before you go for your validation that you have additional control requirements you haven't considered. So please, when you're doing the scoping, be careful, have it validated and double checked before you hit submit, because that's where you will reduce some of your surprises. It might also wind up making a little less work for you in the end.
Yeah, I think that's true. I've had several clients who've said, well, we hope to be here by this point in time. And I'm like, but we're assessing you at a point in time. And so what you want to do is when we're hitting the button to submit that assessment. So you might be getting a big customer next year, but you don't have to assess on that assumption. You're assessing as to where you are today. So once you've kind of got your scope, you have some assessment options. And I'm going to talk about these in kind of order of the amount of assurance you get out of them. The first one is a self-assessment, and everyone really should do a self-assessment. A self-assessment is generally, you can do it in the HITRUST tool, which you purchase from HITRUST, and it loads, you answer those questions we just talked about. It dumps in your controls into the tool, and you go through and you complete the assessment. And we're going to talk about how you do that a little later, but you complete the assessment through the tool. An assessor organization like CompliancePoint or somebody can facilitate that assessment. For a lot of our clients, they will submit it to us as if it was a real assessment, and we will grade it and work with them on the scoring. So we're providing feedback. And when you finish, if you like, you can submit that assessment to HITRUST. HITRUST performs a very limited validation, and they then send this back to you so you can show potential customers or customers that, yes, we are at least making progress towards HITRUST. We've done the assessment, and we have, in that process of the self-assessment, this is when you identify the things that you need to fix before you go to a validated assessment. We do this for a lot of clients. We can do it independently of the tool, or we do it in the tool, but really this is a key component, and it's key to do this right. You want this to be really accurate as to what you have at time when you're doing the assessment. And I think Adam can talk about the benefit of doing this in terms of trying to get ready for your validated assessment, because this is going to drive how you prepare for that validated assessment.
And it's not just driving how you'll prepare for your validated assessment. It really is a wonderful tool to help you gauge your maturity of your own program. Because unlike a SOC 2 or an ISO audit, this is designed to help you prepare, mature, correct, develop. So in our case, our compliance program a few years ago was more of it in its infancy. So we were able to use the self-assessment to say, okay, how do we create a structured information security program? We had the technical security elements, we had the physical security elements, but then we needed the administrative. And I'm sure many organizations such as yourselves have faced that as well. So use it not just as a readiness tool, but a way to say, okay, I do have this, I don't have this, and I can learn from it.
So once you finish your self-assessment and you've addressed the issues and you feel like you're ready to go for a validated assessment, you have a couple of things that happen here. And this is the HITRUST validated assessment. This assessment does require that you use an assessor. What you will do is you will go in, you will score your controls, and we'll talk about that. You'll load your evidence of your controls, and your assessor will work with you on that. The assessor will look at your evidence, look at your scoring, go back and forth with you on how that works and where you are. And eventually you all will decide to submit the assessment to HITRUST. You get two responses out of that. One is the validated assessment. The assessment is reviewed. HITRUST does their QA, they do their testing, they do their reviews, and they decide that you did not meet all the requirements, but you did submit the report. They submit you a report back that says you've had a validated assessment, and here's what you still need to do to get to a validated assessment. Most people, however, though, would prefer to get the second version of this, which is the certified report, where the assessment has been reviewed by HITRUST and the organization has met all the requirements. If there's controls that weren't fully implemented, and we'll talk about that too, how you get there, you have developed a corrective action plan. You are now certified for 2 years. The certification is valid for 2 years. There has to be an interim review conducted on your 1-year anniversary, and that involves an assessor firm. Basically, HITRUST judgmentally or randomly selects a control from each domain and asks the assessor firm to validate that control is still functioning, and also to check to make sure that there has been forward progress on your corrective action plans. HITRUST understands that some of the corrective action plans you implement you may not be able to address in a 12-month period, but they want to make sure you didn't forget about them, and so you've made some forward progress over that 12 months. So we talked about the scoping and how that identifies your controls. So you've got your controls, and that ranges between 250, give or take, to anywhere around 700, depending on your size of your organization and the risk factors that you've identified. For each of those controls, there is going to be a review, and there are 5 things that HITRUST control requirements that HITRUST wants to look to see if you have met for those controls to meet the standard. Policies and procedures are really big. Policies is 25%, procedures is 25%. They have to be very detailed. They have to address all the requirements. The procedures have to say for all the requirements that were in the policy, how are you doing them, who's doing them, what, where, when. For example, on backups, how often are they done, who's responsible, where are they stored, etc. Implemented will be evidence that you have actually addressed the policy and procedure requirements, that you did what you said you were going to do. And the measured and managed, which is probably the most challenging part of the HITRUST control assessment for a lot of people, is evidence of operational and independent measures of the control and the evidence of the actions taken in response to your operational and independent measures. So we talked about the 5 controls. They make up 100% if you add them all together. Basically, for each of the controls, policies, procedures, implemented, measured, managed, you get a maturity rating. And the maturity ranges range from not compliant, where you haven't done anything, to fully compliant, for 100% of the controls have met. So, partially is 50, mostly compliant 75, and so forth and so on. So now we're going to show you this in kind of real world. This is a real control. This is a control that for pretty much most organizations, regardless of their risk, are going to have this as a baseline control. Antivirus and anti-spyware was installed, operating and updated on all end-user devices to conduct periodic scans of the systems to identify and remove unauthorized software. server environments for which the server software developer specifically recommends not installing host-based antivirus and anti-spyware are addressed via a network-based malware detection solution. So you have gone in and you've looked at your policies and procedures and all your evidence, and this is how you're scoring. Your policy, you've got that. You've covered every one of those controls in that policy. You've got that covered. That's 25%. You're good there. Your process, you've got it documented for a lot of stuff, but maybe let's say you're missing some information on that MBMD solution. So you're only getting mostly compliant there. That's about an 18.75% of the component. Implemented, once again, we pull the evidence. There's evidence that antivirus and anti-spyware is working everywhere. Evidence of the MBMD solution, you're in good shape, 25%. Now come the two that I think probably present the most challenge for most of us, is measured and managed. To get a full measured score of 100%, you have to have proved that you have both an operational and an independent measure. It's all documented, and there also have to be metrics. So your goal, for example, in this case would be know your system without up-to-date software and spyware. In this case, we kind of didn't have all that. We have measured, but we weren't really kind of getting there. So we only got somewhat compliant for about 3.75% of that. Managed is you have evidence, you've responded to what you found and measured. And a lot of times while you do respond, one of the big challenges with managed is the documentation to prove it. So in this case, we just didn't really have good documentation, so we kind of wound up with 0. But we've got 75.5% overall. Your control has to be 61% to be compliant. You're compliant. But I think Adam might like to talk to us about how this works in the real world.
I'm still figuring it out. No, just kidding. I was thinking about it as Carol was talking, and having gone through it, unlike school, for those of us who have been through school, have children, etc., it's okay not to get an A. It's okay not to get 100. For many, a C, like the 75.5, to them, that's barely passing. Even if you did a performance review, a 75 feels average. In this case, it's actually okay. HITRUST does not expect you to get a 5 or a 100 right out of the gates. That's where maturity comes into place. That's about evolution. And honestly, personally, I had to get there mentally when I first started working on HITRUST in order to make the most impact. So, focus on the policy, focus on the process, focus on the implementation. Those are actually the biggest 3 things you need to pass. Get that 75. While you're doing it, most likely you'll organically get, using that term again, some measured and some managed, even if you don't realize it. And your assessor firm will actually help you determine whether or not you truly have it or not. Because HITRUST is going to, when they do their QA check, that's where they're going to want to really see the evidence. Do you truly have the measured? Do you truly have the managed? Because for them, that is the maturity. That is the growth. So it's okay if you don't have that 80 or 90 first year out of the gates, even second time out of the gates. That's where you get to grow and achieve.
Yeah, and I would say, I think for a lot of people going through HITRUST for the first time, measured and managed is very difficult because a lot of times you have had to put a control in to meet HITRUST things. You've discovered a control you needed. So you might not have much evidence the first year in particular that you've measured and managed it just because it's maybe only a 6-month-old control or something like that. But if you look, you have to have a 61 to be compliant. If you get between 61 and 72%, you're probably going to have to do a corrective action plan. But if you look, though, if you just do policy, process, and implement it, and you do those right, and you do a good job on those, you're at 75%. You have passed. And while Adam says he got over not getting 100%, as his assessor, I can tell you, I don't know that he really did. He wanted 100% on all his controls. So he worked really hard, but he did very well. And that's the goal, is to get to this 75%. Really, if you focus on those first 3 policy, process, and implementation, it's going to be so much easier for you to pass HITRUST. So once you've scored your controls, you go in, and the scores for each control in the domain are averaged to obtain your average maturity score per domain. So this example, for example, I have 3 of the 19 domains here for somebody. In portable media, they have a 71. You notice that's yellow. In mobile device, they have a 52. You notice that's red. And in wireless, they have a 73. Now, let me point out that this client that I borrowed this from, they haven't finished submitting all their evidence or scoring all their controls. So this is not what they're sending to HITRUST, but this is just an example of how it looks. At this point, the portable media security, if they submit to HITRUST right now, they would have to do a corrective action plan for that domain in total because their domain does not meet the standard. So the way the corrective action plans work, if your domain doesn't meet the standards, you have to do a corrective action plan. And if your control doesn't, but your domain does, you have to do a corrective action plan for that control. So I know that's a lot of corrective action plans, and it can be a lot, but it's not horrible. And then for wireless security in this case, they met the control standard. They are not going to have to do a corrective action plan if they submitted this right now. So that kind of gives you an idea of how this works. One other thing I want to point out, that HITRUST, some of you may have done PCI, and with PCI, you get your assessment and then you have 90 days to correct anything. HITRUST, once you submit this to HITRUST, if you come out with a 52 in mobile device security, they're not giving you another chance to fix it. You have to start over again because once they score it and they review it, it's done. So you need to be ready for them to review it when you hit submit. So now let's talk about the assessment timing, because that's something people always ask us about, is how long does this all take? This is kind of an optimistic timeline, as I've noted. A self-assessment, HITRUST says, can take between 2 to 8 weeks. We'll talk about that in a minute. Remediation varies based on what you find in your self-assessment. If you're in good shape, that can go fast. It also varies on how much resources you want to put into it and how much resources you have to put into it with your ongoing day-to-day activities. And then a validated assessment takes about 6 to 12 weeks for your assessor to do the review after you put the data in. And that, once again, how long it takes you to put the data in kind of varies by client and what they want to do. Right now, based on my last assessment, when we send them to HITRUST, it's running about 12 weeks before you get your report back from HITRUST. I wanted Adam to talk, though, about his experience, particularly in the self-assessment remediation areas.
The self-assessment of 2 to 8 weeks, it's doable, but it also depends on you and your organization. You know, I had the opportunity, I went to Frisco, where HITRUST is located, down in Texas last year to go for my certification. And I was able to sit with and talk with several people starting near the end, different phases. Some of them were trying to push it through in a month. Some of them who were truly just beginning, they were already 2 years in. So 2 to 8 weeks is doable if you have the resources, if you have a program, if you've done things similar to this before. But it really comes down to your uniqueness. Remember earlier we mentioned each organization based on risk factors has a different amount of controls. So, you know, it's hard to say with guardrails, it will never take more than 8 weeks. It might take 10 weeks. It could take a year and a half. So when you're going through it, don't be alarmed if you hit week 9. Don't be alarmed if you hit year 2, because some people only have a 1-person team. Others have 20. So everyone is unique in that instance. The one thing that doesn't change is that validated assessment. Those weeks are about practice the form. So when you go to hit the button to start the validated assessment, my best suggestion, make sure you're good to go. If you have an independent assessor reviewing, partner with them, have them review, have them agree if you're ready to go.
Yeah, I think that's real key that the assessor firm is involved before you kind of are ready for the validated assessment. We like to start working with our clients even as early as the self-assessment, but if we come in later, I will sit down with them and walk through in detail kind of where they are on their controls before we stay to HITRUST. We're ready to do the validated assessment, because that really is kind of you've got about 90 days to do your testing. Your assessor has to do, during that validated assessment, they have to do a lot of testing. They have to validate everything. They have to have a test plan. They have to do work papers for HITRUST. And we want our clients to be ready. My goal is for my clients to all pass. So, before they spend the money to purchase a validated assessment from HITRUST, I want to sit down and say, where are you and what are you ready to go with? And so work with your assessor and make sure they're good to go and that you are ready when you get to that stage, even if you've been doing it on your own up until the time you're ready for a validated assessment. Get your assessor involved early enough to make sure that you are in good shape and they're going to be happy with what you give them and will agree with your scoring and support your case when we go to HITRUST. So as you're thinking about this, one of the things you might want to think about, kind of almost before you even maybe get into the self-assessment, is what can we do to remediate before we really head down this road? So I'm going to talk about where we see some of our clients really struggling to meet some of the HITRUST standards and what they can do before they start down this road, what kind of the preparation. And we're coming back to policies and procedures. Remember I said that was 50% of the score. So you can see where if you have good policies and good procedures, you're ahead of the game when it comes to starting to pass HITRUST because you're at 50% before you load your evidence of your implementation or any measured and managed scores. The policies need to fully address all of the control specifications, and that means they're probably incredibly detailed. So right now, if your policies are based on HIPAA, for example, they're probably not detailed enough. You probably need policies that have policies based on some security standards. You may be getting closer. So you want to get that looked at. That can be something you can ask an assessor firm, for example, for guidance on beforehand. Talk to your peers, but make sure you've looked at your policies and your procedures. Procedures need to document everything in the policies. A lot of times I get great policies, but when I look for the procedure part, it's missing. It's just, we're going to do this. And people will say, well, I wouldn't have put it in the policy unless I was going to do it. And I understand that intuitively, but HITRUST wants you to have documented exactly in detail how you're going to do what you said you were going to do in the policies. And Adam, I don't know if you have any guidance on how you all did your policies and procedures and what you found in this process.
Roughly? No, I'm kidding. For us, like most organizations, our example is exactly what Carol just said. In many instances, we had policies, but we hadn't taken the time to document all of the procedures. We did the work. We know we did the work. We had implementation evidence, but procedures matter. And I remember early on, CompliancePoint said, procedures is the one area where people can get, I won't say hurt by, but hindered by, because they haven't documented it well enough. So that's where you want to spend your time, either putting the language into your policy, thus calling it a policy and procedure, or creating a standalone piece, whatever fits best for your organization.
The other area that comes up is risk management, risk analysis. And I bring this up because a lot of people think that the HITRUST assessment is a risk analysis. And it is and it isn't. It's an analysis of the risk HITRUST has identified to your security. But that doesn't mean there are not other risks they didn't identify. So you need to have done an independent risk assessment, risk analysis in addition to your HITRUST risk assessment. So you can't say, I did HITRUST, I've identified all the risks. They're not going to give you that credit. The questions you're trying to answer there basically are this is basically a HIPAA HITRUST risk assessment. What is the issues that could compromise the confidentiality, integrity, and availability of our protected health information? If that information is compromised, what's the impact to the business or to the individual? And what's the likelihood or probability it will happen? As I said, in addition to HITRUST, this is a compliance requirement for HIPAA, so you should be doing this regardless if you have protected health information. And I've always felt this is an opportunity to identify opportunities for improvement within your organization to help address those risks. The other one that a lot of people have come up to is a business continuity plan, particularly if you're a newer or startup organization. You need to make sure you have really done a good business continuity plan to ensure disaster businesses can continue during a time of emergency or disaster, identify your potential risk and impact. That doesn't mean you have to have, HITRUST doesn't say you have to have a 4-hour backup, for example. You don't have to be back up and running in 4 hours unless that's what your customers and your business need. And that varies based on what you do for a healthcare provider. As to what your turnaround time is and how important you are. If you're actually involved in the clinical care, then your turnaround time is probably going to have to be dramatically higher than perhaps if you are doing self-pay follow-up, for example. So you've got to work all that out before you get to HITRUST.
And if I may, having audited many organizations in the past, people hand a policy over and call it their business continuity policy, thinking that suffices. Or they hand over a single document, calling it their merged business continuity plan, emergency preparedness, and disaster recovery plan. For putting HITRUST aside as a best business practice, that shouldn't cut it for you or your organization. And if you find that's you, this is a perfect opportunity for you to shine and say, you know what, we actually need standalone documents, business continuity plan, disaster recovery plan, emergency preparedness, etc. Because while a lot of organizations, I hate to say this, don't totally see the difference because they can be merged together quite easily. If you're focusing on what's best for your organization, you've taken the time to study, figure it out, and build it. Because like I said, it is a wonderful opportunity for you to shine and to show a strength for your entire organization.
I agree. And the other thing I get handed a lot is the backup plan, which obviously is part of having all that. You know where your backups are and everything, you're ready to go, but you've got to figure out how you're going to get your backups back to life. So backup plan alone also doesn't meet the standard. And then the other area where we see a lot of times, particularly with an organization that maybe is a startup or is new to this, is technical testing, particularly the vulnerability and penetration testing. HITRUST, unlike HIPAA, you are required to have had this testing done. And so that's sometimes people moving from meeting the HIPAA requirement to meeting the HITRUST requirement. This is something they'll have to plan for and budget for in their plan, is to have their vulnerability and penetration testing done and then show that they've done something to respond to identified issues. It's not enough to hand HITRUST the report and say, we did it. What did you do if something was identified is real key to that too. So I know this is a lot to take in, and we'll be glad to answer questions as we go here the next few minutes while we're looking. But we want to thank you for your time, and if you have any individual questions, my contact information up there, and I'll be glad to get back in touch with you. Adam, thank you so much for your assistance.
Thank you very much.
So we're going to respond to some questions now, and we've had one question come in from Graham Johnson, and his question was that he'd heard HITRUST was changing the weighting of the control requirements that we talked about earlier, and that has happened. HITRUST announced on, I think, September 3rd that they're going to readjust the weighting for the policy, the procedure, the implemented, and the measured and managed we talked about earlier. And basically what they're doing is they're moving a lot more of the weight of the measurement to the implemented measurement. So 40% of your control maturity score is going to be, have you implemented the control? Which, if you think about it, makes a lot of sense that that's where the focus is, because having a policy, having a procedure is great, but if you haven't implemented the control, you really haven't addressed the risk. Policy decreases to about 15% of the maturity. Procedure decreases to about 20%. So those three categories, policy, procedure, and implemented, still make up 75%, but the majority of that goes into the implemented category. On the measured and the managed, what they've said is measured is now worth 10% and managed is now worth 15%. It was exactly the opposite before. Measured was worth 15 and managed is worth 10. So not a huge variation there. The biggest variation is in moving so much of the measurement to the implemented score. And so, Adam, what do you think that impact's going to have on your organization?
I'm actually excited by the fact that a bigger emphasis will be placed on implementation, because just like with vendor management or working with your customers on ensuring they have proper controls implemented, it's one thing to write a policy, as Carol has said, and a procedure. You could have done that this morning, but to prove that something has been implemented, that is really the difference between saying you're doing it because you have to do it and want to do it. It's the duration of time, because without it, you really can't show you've done it. So I'm actually glad it actually is moving towards more of a risk-based, prove the evidence approach, as a typical audit would. Not that I'm calling this an audit.
Thank you. We've also been asked if we will be sending out the slides, and we will. We will be sending out the slides. They will be available for download. Colleagues from our marketing team will be sending you the slides and the the link to the webinar so you can watch it later. Let me check and make sure we don't have any other questions. Okay, we do have one more question. The question was, what kind of resources, staffing, and skills are needed for a self-assessment? And how does having a assessment consultant help impact resource and time needs? I think having an assessor, I'll start with the part about having an assessor, and then I might let Adam talk about what kind of skills and resource needs. Having an assessor allows you to have somebody to look at your controls from an objective point of view and tell you how they would score had you gotten them scored in terms of having a true assessment. So it gives you that independent feedback on what it's going to score at and how it's going to look. So I think that's very helpful. We also work with our clients on the self-assessment to help them identify. We work with them to help them identify what evidence would meet the requirements. So we go through and get a good understanding when we're doing that, helping a client, of their organization, how it works, and help them understand what they've already got in place so that they understand what evidence they have now, what controls they have now that actually map to the HITRUST controls. Adam, I think I might let you talk about what kind of resources you all felt like it took to do your self-assessment.
Well, it's hard to answer that question. Kind of like the scoping, it really depends on the size of the organization you have. I have no problems admitting that our compliance team is two. We are just two people, and we work with IT and our technical operations and product and the others. So while we're two, and let's make up a number, our IT could be under 20, but other organizations might have hundreds in their information security team. So it really depends on your size as an organization and the support you have throughout the enterprise. It goes to that partnership that we mentioned earlier on in the conversation. So I know it's not a direct answer, but it really does depend on you guys as an organization size. Now, in terms of the assessor support, that's honestly a great thing to have, because there are times when you're juggling potentially hundreds of controls, you may literally have a brain freeze on what might count as appropriate evidence. So I would reach out to my self-assessment reviewer at CompliancePoint and say, what would help? What'll work? And because of segregation of duties, the person that's providing you that advice is not the same person doing your validated assessment. And so you have some reassurance there that they do really implement their own controls as well. Carol?
Yeah, I would say we do use, to make sure we have segregation of duties, the assessor who might help you with a self-assessment would not be the one doing your validated assessment. But in our case, it would still be a qualified assessor who's qualified by HITRUST, so that they understand the requirements and the regulations. Also, the other thing that's going to impact this is how quickly you want to get it done. On the staffing side, if you're not in a huge hurry, it's not as big of a resource drain. I've had people try to do it very quickly, and you really kind of have to have an all hands on deck and to get it done in the 2 to 4 week period or something like that. So that's a key component too. We have another question. Is there an authoritative entity that can issue fines or penalties in the event of non-compliance? And actually, no. HITRUST is not a regulatory requirement. So not having a HITRUST certification will not lead to direct fines. Now, there are within HITRUST regulations that you have to comply with. For example, HIPAA, and should you have a breach and not have done something that's required by HIPAA, then the Office of Civil Rights would issue you a fine. The same kind of thing with the California Privacy Protection Act. But there's not an overarching regulatory agency that covers the HITRUST assessment. It incorporates all those and doesn't have that individual fine. And the HITRUST people, of course, cannot issue fines. And I think that may be all the questions we have right now. But as we said, we'll be sending out the webinar to you, and you feel free, my contact information on there, feel free to contact us, and we'll be glad to get back to you and answer any questions. Thank you so much for your time today.